Hello and welcome to this edition of Tracking COVID 2019, our special show where we bring together all the national and international updates on the coronavirus outbreak, steps taken by the administration, inputs by reporters, global developments and experts' advice, all packed together in the next half hour. And let's begin now with the top updates. Prime Minister Narendra Modi says we need to move away from darkness and uncertainties brought upon by the coronavirus situation. He gives a call to light up the evening of 5th April at 9 p.m. for 9 minutes. PM appeals not to cross the boundaries of social distancing. Ministry of Home Affairs writes to states over exemption of certain services from lockdown measures. MHA says specific services related to agri-produce marketing, Anganwadi workers and Ayush are exempt from lockdown restrictions. Ministry of Home Affairs blacklists 960 foreigners present in India on tourist visas for their involvement in Tablighi Jamaat activities. Necessary legal action to be taken. Ministry identifies 9,000 people associated with the Jamaat, 1,804 people associated with the Delhi Markas quarantined. Centre launches Arogya Setu app to help assess risk of COVID-19 spread, available in 11 languages. The app can calculate infection risk using cutting-edge Bluetooth technology with algorithms and AI. PIB's fact-check unit on COVID-19 becomes operational. Total number of COVID-19 infections in the country crosses 2,000 with 53 deaths. President Ramnath Kovind holds his second video conference with governors, LGs and administrators of states and union territories on COVID-19 response. Discussion on role of civil society, voluntary organizations and private sector in fighting the pandemic also on the agenda. World Bank fast-tracks $1 billion COVID-19 support for India to help expand lab capacity, procure testing kits and ventilators, set up isolation wards and support research. A number of novel coronavirus infections cross the 1 million mark across the globe, with nearly 53,000 fatalities, even as over 2 lakh people recover. After Italy, death toll in Spain also goes past 10,000. And Prime Minister Narendra Modi shared a video message a short while back with the nation over the coronavirus crisis. He stressed upon community strength, saying that the entire nation is fighting as one, and that this crisis has displayed our collective national unity, making us even stronger to fight and defeat this menace.
कुछ लोग ये भी सोच रहे होंगे कि इतनी बड़ी लड़ाई को वो अकेले कैसे लड़ पाएंगे। ये प्रश्न भी मन में आते होंगे कि कितने दिन ऐसे और काटने पड़ेंगे। साथियों, ये लॉकडाउन का समय जरूर है। हम अपने अपने घरों में जरूर हैं, लेकिन हम में से कोई अकेला नहीं है। 130 करोड़ देशवासियों की सामूहिक शक्ति हर व्यक्ति के साथ है, हर व्यक्ति का संबल है। समय समय पर देशवासियों की इस सामूहिक शक्ति की विराटता, इसकी भव्यता और इसकी दिव्यता की अनुभूति करना आवश्यक है।
In his video address, Prime Minister said that we need to move away from the darkness and uncertainties brought upon by the coronavirus situation. For this, the Prime Minister has requested citizens to switch off all lights on the 5th of April at 9 p.m. for 9 minutes and light just a candle, a diya, or put on the mobile flashlight to mark our fight against the deadly disease.
जो इस कोरोना संकट से सबसे ज्यादा प्रभावित है, हमारे गरीब भाई बहन, उन्हें कोरोना संकट से पैदा हुई निराशा से आशा की तरफ ले जाना है। इस कोरोना संकट से जो अंधकार और अनिश्चितता पैदा हुई है, उसे समाप्त करके हमें उजाले और निश्चितता की तरफ बढ़ना है। इस अंधकारमय कोरोना संकट को पराजित करने के लिए हमें प्रकाश के तेज को चारों दिशाओं में फैलाना है। 5 अप्रैल को रविवार को रात 9 बजे घर की सभी लाइटें बंद करके घर के दरवाजे पर या बालकनी में खड़े रहकर 9 मिनट के लिए मोमबत्ती, दिया, टॉर्च या मोबाइल की फ्लैशलाइट जलाएं और उस समय यदि घर की सभी लाइटें बंद करेंगे, चारों तरफ जब हर व्यक्ति एक एक दिया जलाएगा, तब प्रकाश की उस महाशक्ति का एहसास होगा जिसमें एक ही मकसद से हम सब लड़ रहे हैं, ये उजागर होगा।
PM Modi has appealed to citizens to avoid gathering anywhere during the conduct of this program. He added that people do not have to go out on the streets or in the colonies, but do it from their respective doorsteps and balconies.
इस आयोजन के समय किसी को भी कहीं पर भी इकट्ठा नहीं होना है। रास्तों में, गलियों में या मोहल्लों में नहीं जाना है। अपने घर के दरवाजे, बालकनी से ही इसे करना है। सोशल डिस्टेंसिंग की लक्ष्मण रेखा को कभी भी लांघना नहीं है। सोशल डिस्टेंसिंग को किसी भी हालत में तोड़ना नहीं है। कोरोना की चेन तोड़ने का यही रामबाण इलाज है।
And now let's go on to take a look at the number of confirmed novel coronavirus cases in India, which have risen to 2,069. Of these, 1,860 are active cases, while 155 people have recovered or been discharged. 53 people have lost their lives to the highly contagious disease. And the maximum COVID-19 cases, 335, are in Maharashtra, while 265 cases have been reported from Kerala. Maximum deaths, 13, are in Maharashtra, and 6 deaths in Madhya Pradesh. And let's now take stock of more developments on the ground as our reporters take a look at events and report on efforts related to COVID-19. Our correspondent Jaya Sinha takes a look at the ground situation in Delhi, in Delhi's Dwarka, where the community center has been transformed into an isolation ward for quarantining COVID-19 suspected cases.
Right now we are here at the Dwarka sector 16B outside this community center, which has been transformed into an isolation facility for all the suspected COVID-19 patients. You can see right now there are a lot of people here, there's a lot of security here, and there are a whole set of doctors who are working inside with the patients who are suspected of COVID-19. Currently there are 194 people who are kept in isolation here in this quarantine facility, and the road here is also blocked, and security is there. Delhi police personnel are stationed here 24/7, and they are taking care of a lot of precautions also, and they are following the strict protocol to go inside this facility. You can see here this Delhi police personnel who is about to go inside to take care of the arrangements over here. He is dressed in this hazmat suit with a mask, with the glasses, with the hand mask also, and they are taking care of all the precautions to take care of this isolation facility. Jaya Sinha, DD News, Delhi.
In Karnataka, as part of efforts towards tackling coronavirus, the government has launched a quarantine watch app. The app is for quarantine patients who must send selfies to the government on an hourly basis to monitor their health status. Pictures sent on the app are strictly protected and used by doctors only. My colleague Aisha Khanum reports from Bengaluru.
With the implementation of strict lockdown advisory in Bangalore, the city which was once known as Pensioners' Paradise and Garden City, the chirping of birds can be heard clearly here. But the government is maintaining strict vigilance on those who are quarantined. Unfortunately, the saga of those who attended the Tablighi Jamaat congregation at Delhi also links with South India and has reached Bangalore also. Over 53 people from Karnataka attended this congregation, and Karnataka government has been able to track 13 people who were part of this Tablighi Jamaat congregation, and they have been quarantined medically. Now the government has come up with strict advisory and warned those who have been medically quarantined and are home quarantined, they should send hourly selfie to the government, because this selfie is monitored by the government medically, since it has coordinates of the patients who are staying in their homes, and the government can monitor them on hourly basis. And the government has warned that those who do not send their selfie on hourly basis will be sent to mass quarantines. So the government is taking strict measures to monitor the quarantined people medically, and on the other hand, Karnataka government has also asked the doctors and medical students to register and offer services in the time of crisis. Many students and doctors are registering to come forward and help and counsel people not only fight coronavirus but also help people dispel their fears about common cold and fever as well. The government is implementing strict measures across the state and says that people who do not follow the strict advisory given by the government will be sent to mass quarantines. And the government has already warned that if the state does not follow the lockdown measures strictly, the government will not hesitate to extend the lockdown in the state. Aisha Khanum, Bangalore, DD India.
The government of Assam is strongly enforcing social distancing norms in the state. My colleague Kamal Bora reports from Guwahati.
There will be no relaxation in lockdown, and this will remain till 14th April as decided nationally. And this was the clear message from Assam Chief Minister Sarbananda Sonowal yesterday amidst many speculations over the issue. As the state detects its first positive case yesterday in Borak Valley, right now the process is on to bring all other persons who took part in the Jamaat in New Delhi a few days back under quarantine as much as possible. Right now we have seen that Assam government is leaving no stone unturned to fight against COVID-19. If we talk about preparedness, yes, the state is ready with 4,000 bedded quarantine facilities along with many upcoming dedicated hospitals to deal with COVID-19. If we talk about supply of essential commodities, yes, the state government is taking all measures to get supplied all essential commodities to each and every household. We have seen that free rice, free pulses are being distributed for the poor. And this is how the state government is dealing with this COVID-19. With camera person Hawk, Kamal Bora reporting for DD India.
And amidst the nationwide lockdown, Shillong is another state strictly abiding by the rules and guidelines issued by the Health Ministry. Our correspondent Gautam Kumar from Shillong, the Meghalaya capital, gives us inputs.
We're in the 10th day of the lockdown in Meghalaya, and the state continues to report 0 infections. However, in the neighborhood, states such as Assam, Manipur and Mizoram have all reported infections, and the enemy seems to be closing in. A combination of good fortune and tough measures have seen the state maintain its 0 infection status. Even the spate of infections arising out of the Nizamuddin hotspot seem to have spared the state. This is because the people from Meghalaya who attended the function have not returned to the state. The tough measures implemented include curfew that has been promulgated and limiting the opening of grocery stores and fair price shops to certain days. Today is one such day where grocery shops and fair price shops are open, and as is evident, the people are queued up in an orderly manner. Recent updates from the authorities of the state say that 52 tests have been taking place, and all of which have brought out negative results. Is Gautam S. Kumar reporting from Meghalaya for DD News.
And across the country, the number of confirmed novel coronavirus cases have risen to 2,301. Of these, 2,088 are active cases, while 156 people have recovered or been discharged, while 56 others have lost their lives to the highly contagious disease. 156 persons, as we were telling you, have been cured or discharged. Maximum COVID-19 cases are in Maharashtra still. 286 COVID-19 cases reported from Kerala. And maximum deaths are in Maharashtra again. Madhya Pradesh has reported 6 deaths so far. And women auto drivers in Maharashtra's Thane are helping people reach the hospital in a medical emergency. Nearly 25 of them have helped pregnant women, dialysis patients and the elderly reach the hospital on time. Mind you, they offer the service free of cost to women. With the approval of the district magistrate, a helpline number has been issued by Thane Regional Transport Office for rickshaw on demand in the city. The helpline number is 99673 12176. I repeat, 99673 12176. The service is available between 10 a.m. and 5 p.m. daily.
कोरोना वायरस का संकट पूरे महाराष्ट्र पे या पूरे देश पे आया है और ये इसमें रुग्ण जो इमरजेंसी है, जिसमें डायलिसिस करने जाना है, जिसको ब्लड चेक करने जाना है, जिसका रूटीन चेकअप है, इसलिए हमने हमारे अलग मंत्री एकनाथ शिंदे साहब और लोंडे साहब और सूर्य मामा के इनके माध्यम से इनके समझने से हमने एक व्हाट्सएप ग्रुप तैयार किया है और ये व्हाट्सएप ग्रुप पे हमको मैसेज आता है, वैसे हम लोग रुग्ण के पास जाते हैं, उनको हॉस्पिटल पहुंच जाते हैं.
Tirupur in Tamil Nadu has set up a unique disinfection tunnel at the entrance of the Thennampalayam market as part of precautionary measures against COVID-19. People are sprayed with disinfectants as they pass through the tunnel. Workers and members of the public have been advised to raise their hands with their palms facing in the front while entering the tunnel to ensure efficient disinfection. However, this disinfection tunnel is only a supplement to precautionary measures such as frequent hand washing. And as India's efforts to fight the threat against the spread of COVID-19 are underway, the Ministry of Home Affairs issued an addendum on services exempt from the lockdown. In the addendum, the Home Ministry exempted specific services which include direct marketing of agricultural produce, food and nutrition support to children, women, lactating mothers, Anganwadi workers, medical services and drug manufacturing under Ayush category. And under the directions of the Union Home Minister Amit Shah, the Ministry of Home Affairs has blacklisted 960 foreigners present in India on tourist visas for their involvement in Tablighi Jamaat activities. MHA has also directed DGPs of all concerned states, union territories and CP Delhi Police to take necessary legal action against all such violators on priority under relevant sections of the Foreigners Act 1946 and Disaster Management Act 2005. As earlier informed by the government, 9,000 such people connected to Tablighi Jamaat have been identified and quarantined under the Home Ministry's massive effort in consonance with states and union territories to trace the workers and their primary contacts. This included 1,306 foreigners. Delhi's markers had about 2,000 Jamaat workers, 250 foreigners, out of which 1,804 have been quarantined. 334 people who were symptomatic have been hospitalized. And the PIB Fact Check Unit on Thursday released 3 fake news reports. The first relates to fake circular being forwarded in various platforms saying that it is a press release of the CBSE. The second news is about a circular reported to be issued by the Medical Council of India. The news regarding CBSE says a fresh notice has been issued on board exams. And the news says CBSE will conduct pending exams of 10th and 12th from the 22nd of April 2020 onwards. This is fake news as CBSE has not put out any such circular. Other news being circulated on social media is with regard to the Medical Council of India and undergraduate classes. The news is fake as the MCI has not put out any such notice. Another piece of false and misleading news being circulated on social media states that the Disaster Management Act has been implemented across the country. The news that is fake adds that apart from government departments, no other citizen is allowed to post or share anything on COVID-19. This is fake news as such a notice has not been put up by the government. And President Ramnath Kovind, along with the Vice President Venkaiah Naidu, interacted with governors, lieutenant governors and administrators of all states and union territories through a video conference to bolster the efforts at the central and state level to contain and manage the crisis arising out of the outbreak of COVID-19. This is the second such video conference with governors, LGs and administrators of states and union territories. In the first video conference held on March 27th this year, 14 governors including Delhi Lieutenant Governor, shared experiences in their territories. The agenda of the conference is the status of COVID-19 in the states, the role of the Red Cross with a focus on vulnerable sections, and the role of civil society, voluntary organizations, private sector in complementing the efforts of the union and state governments. And let's now take a look at what else is making news around the globe in this segment. On the latest update on corona, infections across the globe have crossed the million mark with nearly 53,000 casualties and over 2 lakh people recovering from the deadly illness so far. US President Donald Trump has said that he underwent a second coronavirus test using a rapid diagnostic that produced a result in just 15 minutes. And it has been determined that he is not infected. Trump announced that his test results during a White House briefing, and he announced plans for the US military and federal personnel to operate a makeshift hospital set up in the Javits Convention Center in New York to help the city grapple with the flood of patients in his daily White House briefing. New York has become the epicenter of the US epidemic with more than 47,000 confirmed cases in the city. And well, with that, it's a wrap on this edition of Tracking COVID-19. Keep washing your hands, maintain social distancing and avoid going out as much as possible. Thanks for watching. Namaskar.